Okay, welcome everyone. In the previous video, we have studied about the basic anatomy and structure of the eye. In this video, we are going to study little deeper. So the anatomy of the outer layers of the eye. So what are the outer layers of the eye? So it's cornea, sclera, and the limbus. So first, let's study about the cornea. So can you guess how many layers are there in cornea? The layers of cornea. Any guess there is how many layers are there in cornea? So in the recent study in the 2014 they are updated the cornea. There are the totally six layers are there in the cornea. So understand this easily. Let me draw the cut section of the eye. So please remember this diagram. So this diagram is we are going to use it in so many videos. So this is the cut section of the eye. Okay, let me label the parts. So this is your optic nerve, and this one is your lens, and this is your iris, and here it's called as pupil, and this part, the junction, is called as limbus, and this is your sclera, and this part is your cornea. So let me magnify this cornea. So we are going to study about the cornea. So let me magnify this cornea. So this cornea has 6 layers in this. This is the outer layer, and this is the inner layer. So the outermost layer, this outermost layer is also called as anterior layer. And the inner is called as the posterior layer. So whenever we are going to study, we will study from the anterior to the posterior layer. So the layer 1, layer 2, it's called as the anterior layer, and if we go deep, so the layer 5, 6, and we will going to study that as the posterior layer for the better reference. So whenever, not only in this, whenever we study about the anatomy, we should study from the anterior to the posterior side. Let me show you an example. So here lies the retina. So this is our retina. If we consider this as a retina, it has the retina has totally 10 layers. So we will study about this in deeper in the further videos. So in this retina, it is located inside the eye, but this part is called as the anterior of the retina, and this side is called as the posterior of the retina. So I guess now everybody will be clear in this. Now we will move on with the first layer of the cornea. So what is the first layer? The outermost layer. The outermost layer is called as the epithelium. So the first layer is called as the epithelium. So epithelium is your outermost layer, and it's also called as the anterior layer. So in this word, the epi is the Latin word of the meaning it's outside. So whenever we think of the first layer or the outermost layer, we should think of this epithelium. So this is your first layer of your cornea. So whenever we study about epithelium, we should think of these 3 points. The epithelium is non non-keratinized, and then it is stratified, and the third point is a squamous. So why it is non-keratinized? So when we study about the skin layers, it is keratinized, so which gives the colors and everything. There are keratinized cells are present, but in the cornea these keratin cells are absent. So basic thing is the we studied that the cornea is transparent. So for transparent it doesn't require any color. So the first point you should remember is the it is non-keratinized. So next we will move on with the stratified. So whenever we study non-stratified is the single layer of the cell. But in this cornea, it is stratified. The stratified means it has different layers. So that is called as strata, different layers. So let me draw a diagram. So this is your basal layer, and this is your middle layer, and this is the superficial layer. So here the basal layer has the columnar cells, and then the superficial layer it's kind of flat, so it is called as squamous cell. So in the middle layer is getting compressed between the basal layer and the superficial layer, so it is called as polygonal, and this, it doesn't have any shape, it is compressed in between those. So what do you need to remember about this basal layer is, so this basal layer is can undergo mitosis. So what do we know about this mitosis? This mitosis can be divided into the cells, divided into number of cells. So what is the use of this? So we can say this as the corneal epithelium can regenerate. So due to this mitosis, the corneal epithelium can undergo regeneration of the cells. Okay, now we will move on with the second layer of the cornea. The second layer is also called as Bowmans layer. So what are we going to study is two important points. The Bowmans layer, it's does not true basement membrane. True basement membrane. So where would be the basement membrane? We'll go on to this basal layer. Below this basal layer, there should be a membrane. Here it is the Bowman's layer. It should be a basement membrane. But why are we saying this? This is not a true basement membrane. Is it does not strain the its pass negative. So if it is a true basement membrane, it has to strain with the pass test. But this Bowman's layer, it does not stain with pass test. So how we can easily remember this? In the alphabet, B is the second alphabet in the alphabetical letters. So B, here the B, the second layer of the cornea is the Bowman's layer. And the third point is, it is acellular. So acellular means it cannot regenerate. So it cannot regenerate of cells. So if we have a corneal trauma, until this epithelium, we studied this epithelium is can undergo mitosis. So they can regenerate and they can heal by themselves. But this Bowman's capsule is acellular. Uh, this Bowman's layer is acellular, so they cannot regenerate. So how they will get healed? They will healed by the scar formation. Scar formation. So the scar formation will lead to some corneal opacity. So already we studied what is the opacity. Opacity does not allow the light to pass through. So the patient will suffer from this trauma, this kind of that Bowman's layer trauma. They will lead to some loss of the vision. Loss of vision. So if they get damaged of this Bowman's layer, they may not able to see clearly. So they may suffer from the loss of the vision. So now we will move on with the third layer of the cornea. The third layer of cornea is called as the stroma. So the stroma gives the 90% thickness of the cornea. So we all know that the stroma contains of collagen. So here it is a MCQ. The most common type of collagen is type 1. The stroma is the most common type of collagen is type 1. So between the collagen fiber and fibrils, the space filled is so in between this collagen fibers and fibrils, we have a brown color substance. It's called as the gags. So gags is nothing but glycosaminoglycans. So most common type of gag is keratin sulfate. So next we will move on with the fourth layer of the cornea. The fourth layer of his cornea is called as the Duas layer. So this layer, this is discovered by Dr. Havinder Dua. So this is the reason it got the named as the Duas layer. So what you should remember about this Duas layer, this is the strongest layer. This is the strongest layer of the cornea. The thickness varies from the thickness. So the thickness varies around 7 to 14 microns. So these are the points you should remember about this Duas layer. There is nothing more. So what you should remember is this is the strongest layer of the cornea. So now we will move on with the fifth layer. The fifth layer is called as the Decimus layer. So this layer is secreted continuously by the underlying endothelial cells. Endothelial cells. So these cells can undergo regeneration. So these cells can regenerate. So if any damage happen to this cell, this layer can regenerate. So what is the thickness? So this thickness of this layer increases throughout life, throughout the lifetime. So when the baby is born, the thickness is around 3 microns. So when you grow to the age of 10 years or 11 years, it may become up to the 10 microns. So this thickness of this membrane increases throughout the life. Then the peripheral uh, termination of Decimat's membrane is called as Schwab's line. Schwab's line. So now let's move on with the outermost layer. Okay, now let's move on with the sixth layer of the cornea. It is the innermost layer, or called as the posterior layer, is endothelium. Endothelium. So epi means the outermost layer, and the endo means the innermost layer. So it is the single cell layer. Single cell layer. So this is the metabolically active layer. So this layer helps in the corneal transparency. So this layer helps in the corneal transparency. So helps in the corneal transparency by maintaining these two main functions. Helps in the sodium potassium ATPase pump to maintain the corneal dehydration. So maintain the corneal dehydration. Then another important main function is by maintaining the tight junctions between the adjacent endothelial cells. So this is a function of the endothelial cells. So let me explain it clearly. Let me draw a rough cut section of the eye. So this is your iris and this is your lens. So we also studied that there is the aqueous solution. So here is your cornea, and here is your endothelial cells. So here you have the aqueous, so water. So what is the function of this endothelial cell is, it forms the tight junction in the innermost layer of the cornea. So it does not allows the water to enter inside your cornea. So this is the function of the one is the sodium potassium ATPase pump, and it forms the tight junction. So this is the function of the endothelial cells. From this we are completing the layers of the cornea. Now let's move on to the second outermost layer. The second outermost layer is called as a second outermost layer is called as the sclera. So what are the points you should remember of this sclera? It is the posterior part of the outermost layer. It covers the 5 by 6 part of your eye. Uh, so its sclera, it is white in color. So white in color and it's opaque. So why it is opaque? So the collagen fibers spaced irregularly. So this is spaced irregularly. So that's why it does not allows the light to pass through the sclera. So that's why it's called as opaque. So opaque. Now let's move on with the thickness of the sclera. Thickness. The thickness of the sclera is varies. So where it is thickest and where it is thinnest. It is thickest among the optic nerve. Insertion of the optic nerve around 1 millimeter. So where it is thinner? Uh, Thinner is uh, posterior to the insertion of recti muscle. So in this the thickness is 0.3 mm. So the examiner can ask the question as where is the sclera is the maximum thickest is seen is near the optic nerve, and where is the thinnest is the posterior to the insertion of the recti muscle. Now we will move on with the layers of the sclera. In cornea we learned that it has the 6 layers, but in sclera we have 3 layers. So what are the 3 layers? Episclera. Episclera. So we learned that the word epi means it is the outermost layer. So from in the sclera, the episclera is the outermost layer and it is densely vascular. So it has the superficial blood vessels and the deep blood vessels. And the second layer is sclera proper. So this is this avascular. The second layer is sclera proper and this is the avascular. And the third layer is lamina fusca. So this is the innermost layer, lamina fusca. So from this we are completing our layers of the sclera. Now we will move on with the third outermost layer called as limbus. So let me recall you with the rough diagram. So this is your optic nerve and this is your iris and this is your lens and here your pupil. So let us study where is the limbus. So we studied that this is the cornea. So this is your cornea and this is your sclera. So we learned that the junction between the cornea and the sclera, this junction is called as the limbus. From this we are going to study our first point. So it is also called as corneoscleral junction, and it has the special type of cell called as stem cells. It has stem cells in it. And location, we'll move on with the location. Location is epithelium of specialized cells known as palisades of Vogt. So this is the location of the limbus, palisades of Vogt. So here you have the important MCQ point. So the specific marker for the limbus is ABCG2. So this is one of the important questions they asked twice in your exam. And now let's move on with what is the universal marker. So universal marker of the limbus is CD34. So you have to remember these both. If they ask you the specific marker of the limbus, the answer is ABCG2, and if they ask the universal marker of limbus is CD34. Okay, so in this video we are completed our outermost layers of the anatomy of the outermost layer of the eye, that is your cornea, sclera and your limbus. So in the next video we will study about the anatomy of the middle layer of the eye, that is your iris, ciliary body and your choroid. So for more video, subscribe to this channel. Stay happy, stay healthy. Bye bye.